Welcome to Yellowbrick. Yellowbrick's mission is to be the national leader in the psychiatric treatment of emerging young adults aged 16 through the 30s and their families. Our core values are integrity, excellence in innovation, and value through outcome. Yellowbrick was founded and born in a response to what we began to see happening in the healthcare system as a whole and in mental health care in particular. And there were basically three things that we experienced and observed as trends that were not really in patients' and families' best interests. The first of those was that, as I'm sure you're all aware, there was a centralization and from mergers and acquisitions in the healthcare system that changed the way in which psychiatry offered treatment. Treatment became more focused on crises, on episodes of acute distress, and treatments were shorter term and offered in terms of education, support, and skill building, which for many patients is fine. But there are increasingly more vulnerable emerging adults for whom that approach is not sufficient. That Yellowbrick saw the need for an approach that went deeper in terms of the problems of self and identity, on the struggle around the uncertainties of life for the emerging adults, and that many of them had problems which were never really fully recognized, such as learning disabilities and processing disorders, and problems in the way that they are able to problem solve and think for themselves and plan. And so Yellowbrick put together a model which combines the latest in neuroscience technologies, the latest in neuromodulation, psychotherapies, a deeper approach to self-development, and an approach which addressed the way in which people process information and make decisions for themselves. The second trend that we saw that was services started to become in relationship to diagnosis. And of course, that's very important. But in this age group, it's really most effective when you think about these are people whose brains and whose lives are in the process of development. And so how do we think about supporting that development, putting wind to the back of that development, and trying to remove some of the roadblocks for that development? The way we've answered that question is we've looked at those parts of the brain which are not yet fully mature. And now with the benefit of neuroimaging, we can know that in a very precise way. And we can support the maturation of the brain and the mind towards areas like self-identity and self-integration and coherence, self-regulation skills, executive function and life skills, the development of a full range of attachments with varying levels of intimacy which are appropriate for that context, and a renegotiation with the family of origin. These are the universal challenges of all young adults in whatever way they may begin to falter symptomatically, which we will also address. But Yellowbrick's partial hospitalization program and IOP program is organized around one or more of these universal challenges developmentally. The third issue that we recognized was that as mental health care systems and hospital systems became larger and larger, patients and their families kind of got lost in the shuffle about that. And so Yellowbrick committed itself and works hard every day to really address what are the personal needs that each individual and each family has, and how can we be responsive to them in a very customized way. Many of the people who've sought mental health services have hard feelings about the way in which the system has received them and responded to them. And we want to make sure that we're full partners with the emerging adults and their families, and we rely on the relationship as the foundation for treatment here. Thank you.